Good evening, everyone. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UV rays, which make skin more prone to wrinkles, melasma, and even skin cancer. We know that sunscreen is valuable from a skin cancer and sun damage perspective, as well as something that helps prevent fine lines and wrinkles. But according to a survey, 67% of people in India are yet not using sunscreen as a daily skincare routine. There are several things about sunscreens that we people are not aware of and that make us not to include sunscreen as an integral part of our skincare routine. So to keep you informed, today we are here to know more about sunscreen in skincare regimen. So let's connect today with our skin expert, Dr. Kapil Chandra, consultant dermatologist, Chandra Clinic, based at Delhi. Dr. Kapil Chandra is an eminent dermatologist having more than 10 years of experience as a specialist. He has won awards in the field of acne management. He is certified by European Academy of Dermatologists and Venerologists. He is certified by the American Academy of Dermatologists for excellence in dermatology. He has been certified in cosmetic dermatology by CosDerm India, Aestheticon, and several other societies. A very warm welcome to you, Dr. Kapil Chandra. It's a pleasure to have you with us today.
Thank you very much. Thank you.
So, Dr. Chandra, today we are going to talk about a very important thing, a very essential thing, which should be in our regular skincare regime, that's sunscreen. But the fact remains that 67% of people are yet not using sunscreen as a regular thing. So, first of all, I would like to understand that why sunscreen is so important, why we need to apply sunscreen regularly, religiously.
So first of all, every day we are exposed to sun and it is being degraded every day. So sunscreen protects us from the UVA and UVB rays. So nowadays we have a mixed sunscreen, which is broad spectrum sunscreen in which they filter out the UV and UVB rays, which eventually are causing degeneration to your protein, skin, elasticity. They are giving pigmentation as well, and they are putting your wrinkles more faster. So we need to understand using sunscreen judiciously prevents us from all these things. And as the world is, striving for anti-aging products, this is the most important compound to help us out in doing that, because we are using retinols and many things, but we don't
Mhm.
concentrate on sunscreen, which is the most important part for the every regime.
Right. So you are also considering sunscreen as a good anti-aging product, right? We'll discuss on that as well, doctor. But before that, because many times people feel and they'll often say that sunscreen protects us from the harmful radiations emitted by the sun, UVA, UVB. But my exposure under the sun is not that much. I don't go out much, or I work, from home, or I'm mostly inside home. I don't go out. Why should I use sunscreen, doctor?
Yes, because these days we understand that the normal visible light and the LED lights are also causing damage to our skin. Although that that part is a little less, but then yes, using sunscreen is important. See, I am sitting in a room which has got a light coming up, and now this is the time when I also require sunscreen because this light is reflected and is coming on my face, which can eventually cause damage to my face. So if you're at home, but it is it is an open home, or you have sun coming from outside, then obviously you require a sunscreen at home also. Then you can step out, out of the home for 5 minutes or 10 minutes. And that is a time when your body is not toned for sun, and it can get more exposed or, more burnt out because of the sun, because your body is not ready to accept the sun because you are not going out usually. That is another reason. And then, as I told, that UV light from the, laptops, from the screens are also troubling us, which can also enhance our pigmentation over the period. So these days we have a concept of infrared radiation, which should also be protected with sunscreens.
Okay. So even if I'm not going out, I'm working from inside, but the light from my laptop or my mobile or the other radiations coming from various sources of light can be dangerous for my skin. So I need sunscreen. Another very common myth is, doctor, कि sunscreen use करेंगे तो हमारी body vitamin D नहीं absorb कर पाएगी, तो हम vitamin D deficient हो जाएंगे. I'm sure you must have heard this many times from your patients. What's your take on that?
तो डेफिनेटली सनस्क्रीन लगाने से, बिकॉज आपको सन का वो नहीं मिलेगा एक्सपोजर उतना, बट यू आर यूजिंग इट ऑन द फेस मेनली, सो एक्सपोज एरियाज बाकी दे विल गेट द सन, and it is not the complete protection. See, sunscreen degrades over the period. No one is using sunscreen n number of times. See, ideally sunscreen should be used every 3 hours, but as soon as you use sunscreen, उसका protection ज्यादा है. जैसे जैसे आप वो time period बढ़ता जाएगा, उसका protection कम है, and you will get some rays, एंड उससे विटामिन डी बनता रहेगा, एंड यू कैन गेट विटामिन डी ऑन योर आर्म्स, लेग्स, जहां पर भी सन एक्सपोजर और हो रहा है. सो फेस इज द मेन कंसर्न वेयर वी नीड टू पुट सनस्क्रीन, सो दैट विटामिन डी डेफिशिएंसी भी नहीं होगा, एंड यू विल गेट द सन प्रोटेक्शन फॉर द फेस एज वेल.
Right. Now, whenever we go out to buy a sunscreen, there are so many information on the box. There's so much information written on the tube of that sunscreen. But then we don't know what to go for. What are the basics, doctor? वो कौन सी ऐसी चीजें हैं जिनका हमें ध्यान रखना चाहिए जब भी हम एक sunscreen लेने जाएं अपने लिए?
सबसे important, see, there was a research in US in which they said that 75% of the sunscreen will have a good feel factor, but they might not be working. So सबसे पहले हमें SPF और UVA protection, ये सब तो हमें देखना ही है. Everyone is doing that. SPF is more than 30 is good for Indian skin. Anyone can use more than 30. It is not necessary that you require a 70 or 80 SPF. Anything 30 to 50 is sufficient for our skin. Then other thing is UVA protection. So we have in India PA plus rating. So that blocks the UV part, UVA part. So PA plus rating and SPF. SPF is for UVB. So these are the two criteria what you look forward for the any sunscreen. And then other thing is a good brand helps us out, because most of the brands will not deliver that much what they're claiming. So you should be wiser with the brands that yes, these are authentic brands and I'll go with them.
Right. What do you recommend, doctor? Going for medicated sunscreens are better because there are so many products over the counter. There are so many products. There are so many brands, companies coming up with sunscreen lotions. There are influencers on social media who are endorsing various products, various sunscreens. So we as laymen, get confused. So dermatologically approved or medicated sunscreens are okay to go for, safe to go for?
It is a tough job again for as a dermatologist also. We do not know how many sunscreens are good or bad because we cannot try every sunscreen. So
Right.
market is loaded with cosmetic brands. So I tell my patients that any good brand like a Sebamed, Cetaphil, big brands, they probably are doing great job. So cosmetic sunscreen are also not bad, and medicated, obviously they have invested a lot in that SPF factor and there is a quality check on them. So probably they are also doing a good job. So it's a combination of medicated and a good cosmetic brand can be used.
Right.
Either of them.
How important is keeping in mind our skin type and our working conditions? Because my working condition may be different from somebody else's. My exposure under the sun could be more than somebody else's. So they also play a role in choosing the right sunscreen?
Now, you have sunscreen with many things. You have a sunscreen which is gel based, which is a water based sunscreen. You have a cream based, lotion based. So it depends on your skin type, which sunscreen will you use. So if you have a oily skin, probably you will use a matte or a gel based sunscreen. But if you have a very dry skin, then probably a lotion based sunscreen makes more sense. Now again, as you rightly said, suppose my exposure is not much, so probably I'll use sunscreen just once. But if I'm going out in sun much, if I have a lot of driving included in my work job, so sunscreen repetition is very important. As you apply the sunscreen, it starts degrading over the period, and in 2-3 hours it will degrade. So if you're going out a lot, then apply it every 3 hours. And the
Okay.
quantity is very important again.
Then let's talk about that, doctor, because many a times we have heard though that amount or the quantity of sunscreen is important. Application, reapplication, they all play a major role in the effectiveness of sunscreen. But then we don't know exactly how much to apply, when to reapply. We would like you to shed some more light over that, doctor.
Right. So for sunscreen application, first rule is that you should apply before pushing out to the outside environment 15 minutes prior to that, at least 15 minutes to 30 minutes, and it should be repeated every 3 hours if you're out in sun. The quantity is very important. It's 2 milligram per centimeter square, which comes out to be approximately 2 fingertips, fingers, 2 fingers, but it is very tough to apply. In normal condition, if you apply 2 fingers, your face will become very whitish or you'll have a white cast. So usually what I advise my patients is a finger will do, and then repeat it every 3 hours if you can. That is the most important thing. The problem what we face is with the kids. Kid is going to school at 7 o'clock in the morning. But when they are coming back, that is the most important time when we require the sunscreen. And that is the toughest part, how we can do that. So I tell my patient, you can keep a wet wipe and just apply it in the lunch break. That is how you can do that.
Right. So sunscreens are safe for our kids, for children, for toddlers?
We don't advise for toddlers, but yes, we have a physical blocker sunscreen in which kids can apply it, in which you do not have a chemical. So, like titanium oxide or zinc oxide sunscreens are safe for the kids because they do not have chemicals. And there are sunscreen which come from 3 years of age, and you can use them with the kids as well.
Okay. So even if it's about these kids or even if it's about us, can we go and consult it with a qualified dermatologist like you so that because many times, we don't even know our skin type. We can assume that, okay, I have oily skin, but then I'm not very sure about it. Maybe I have a combination skin. So is that a better idea to go and consult a dermat?
It does help you out because a dermat will ask you questions about your skin type, and then over the period, he or she can help you out. Which are the best sunscreens? Probably two, three, which you can use. And if you are using for a kit, because you might not be knowing that this is the physical blocker or a chemical blocker.
Right.
So he or she can help you that this is the only physical blocker and it will not harm the kid. And you can continue the sunscreen probably till 10, 12 years of age, and then you can shift to a better sunscreen.
Right, because children's exposure under the sun is more. They play a lot under the
Play a lot
sun. Even their screen time is equally increasing if we are saying that the
nowadays.
radiations emitted from the screens are equally dangerous. So, yeah, they can use these sunscreens and, of course, talk to a qualified dermat to get better suggestion, to get better advice. Now, the thing is, doctor, many a times pregnant ladies get melasma or pigmentary issues. Many a times I have seen it's written on the sunscreen that, if you're pregnant or you are lactating, please consult your doctor before applying the sunscreen. So why we need to, play or be more cautious while using the sunscreen, especially on pregnant or lactating mothers?
See, there are some reports that benzene sunscreen can cause a hormonal changes. So that is the reason that we try to avoid sunscreen, which are more of chemical content. So physical blocker again comes into the picture. They are the safest sunscreens. They can be used in the pregnant lady as well. And so if you are out from chemical, probably then you can use that. And that is why you need to read the leaflet, because in which there is a chemical part, they will tell us that try to avoid it in pregnant ladies. And benzenes are the most important compounds. So avobenzene, oxobenzene, we need to be wiser with these compounds.
Okay. So, if you're pregnant or you're lactating, please consult your dermat and you can definitely switch to a physical sunscreen. Now, doctor, because you have mentioned this physical sunscreen, we would like you to shed some more light over what are these physical sunscreen and how are they different from the chemical ones, or what kind of sunscreens are there in the market?
There are many sunscreen which are only with the physical blockers, and there are two main compounds which are there in the physical blocker, which is zinc oxide and titanium oxide dioxide. And they cause the problem with these sunscreen is because they cause a little white cast. So now the companies have come with nanoparticles. So they do not leave that white cast, but there is a hypothesis that these nanoparticles can be absorbed by the body, and probably in the long term they might harm us, but we do not have those reports. So titanium oxide and titanium dioxide and zinc oxide are the simplest sunscreens. The only problem is white cast, and they will not cause any damage to your internal body part usually. And that is why they are the safest. Now there are many brands which have come up. They will have written, they will write it. It is safe for the kids. It is safe for the pregnant ladies, and they will write it like a soft. You have a Suncross soft brand. You have many brands like Sebamed brand, Cetaphil brand. So they are more of physical blockers, but you have a combination. In Cetaphil you will have 10 sunscreens. So you'll have to find it out which is with the physical blocker only.
Okay. And doctor, we would also like to know more about SPF factor, because SPF factor, as you also mentioned, is very important to look for SPF and the boot star rating, etc. Now, we as a layman, when we go out to buy a sunscreen, because we are little aware of this SPF thing. Now we know that from 15 to 20 to 30 to 40 to 50 to 60 to 70. I've seen sunscreen with 80 SPF as well. But then we don't know the highest is better, or where should we go for, which one we should go for. How should we decide the SPF factor, which is the best one for us?
The literature says that anything, see, 20 SPF protects us from UVB 93% almost. And
Hmm.
as soon as you increase the SPF to 70, it is just the 97% what is, this is only 4% what you're saved. So suppose a person who is more into sun, who is a player, who plays a lot, who drives a lot, probably for them, it is more than 50 SPF or 50 SPF is the standard. But for a guy who, drives for 10 minutes, who goes out in sun for 10 to 15 minutes, 30 SPF is more than sufficient. 30 to 40 SPF is more than sufficient. As soon as you increase the SPF, there are two problems with that. एक तो जो consistency है, that will become thick. So you'll not be applying that much amount. The other thing is it becomes expensive also over the period. And sometimes it can cause more irritation because there are more compounds to help you out. So these are the three problems with higher SPF. So in fact, in US, they have, they have discontinued the higher SPF for Neutrogena brand 70 SPF because it was not found to be more effective than anything, any 40 SPF or 50 SPF. So the percentage is only 1 to 2%, which increases by increasing so much SPFs. We don't require that much.
राइट। तो फिर भी एक नॉर्मल कंडीशन में अगर हम बात करें इंडियन स्किन टोन के लिए तो क्या एसपीएफ
30
ठीक
to
रहेगा
50 SPF के बीच में is more than sufficient. So you can buy a 30 SPF good sunscreen or a 50 SPF. If you're more exposed to sun, 50 SPF, वरना 40 to 30 is more than sufficient.
ओके। कुछ हमारे व्यूअर्स के क्वेश्चन ले लेंगे उसके बाद आपसे बातचीत हम जारी रखेंगे। नेहा शर्मा है पूछ रही हैं हाउ लॉन्ग डज इट टेक फॉर सनस्क्रीन्स टू स्टार्ट वर्किंग आफ्टर एप्लीकेशन?
As I told you, 15 to 30 minutes.
हम्म।
15 से 20-30 मिनट के अंदर वो काम करना शुरू कर देते हैं।
और कई बार ऐसा होता है जब निकलना होता है तब याद आता है कि अरे सनस्क्रीन तो लगाया ही नहीं 15 से 30 मिनट पहले, तब
मोस्टली
लगा
ऐसा ही
सकते
होता
हैं क्या?
है, लगा सकते हैं। मोस्टली ऐसा ही होता है, लगा सकते हैं। उसका एक्शन 15 मिनट्स बाद शुरू होगा, तो आप कोशिश करें कि उस टाइम पर थोड़ा सा सन से बचे।
ओके। फिजिकल सनस्क्रीन में भी क्या कुछ पहले से लगाना पड़ता है और
आइडली
स्टार्ट
आइडली
वर्किंग?
आइडली नहीं, क्योंकि फिजिकल तो लगते ही वो ब्लॉक कर देगा, बट यूजली मोस्ट ऑफ द सनस्क्रीन हैज गॉट फिजिकल एंड केमिकल ब्लॉकर। केमिकल वालों का एक्शन स्टार्ट्स आफ्टर 15-20 मिनट्स।
ओके। तमन्ना हमारे साथ हैं, उनका क्वेश्चन है आर देयर एनी स्पेसिफिक इंग्रेडिएंट्स आई शुड लुक फॉर और अवॉइड व्हेन चूजिंग अ सनस्क्रीन?
See, most of the sunscreens are pretty good. As I told you, there was only one report in 2020 by a company which said that benzene compounds can cause a little hormonal changes, and over the period they are linked with cancer. So now you might be hearing that overuse of sunscreen can cause cancer, but there is only single report and which we are not very sure of. So benzene are the only compound which you should try to avoid. Otherwise, every compound is safe to be used in sunscreen.
Right. Ashish is asking, can I use the same sunscreen for both my face and body, or should I use different products?
You can use the same sunscreen. The only problem is body, you require a larger area. So face sunscreens are little expensive and little small bottles come up. So it is very tough to apply on the body. If you start using the same sunscreen on the body, it will finish off in 3 days itself. So
Right.
we advise my patient that use a lotion based sunscreen on the body, which have bigger packs, and you
Hmm.
don't probably require that much high SPF. And for the face, you use the best of the sunscreen, which suits your skin.
Right. Kirti Kapoor's question is there a difference in the effectiveness of spray on sunscreen versus lotion or cream-based sunscreen?
See, there are no as per studies regarding the same, but yes, because they have studied mainly the lotion or the cream-based sunscreen. Spray came up later on, and it has been also used, but it is mainly for the body sunscreen. So they have not compared this. Probably we do not have the best answer, but yes, both can be used. But there are nowadays sticks coming up, which probably I feel they do not work that well. So spray is equally good as lotion because eventually it will get absorbed in the body and will work well. The only thing is the quantity, probably you might not be able to measure it properly with the spray form.
Right. True. So Priya Jha's question is, how can I incorporate sunscreen into my daily skincare routine effectively?
Very, very important question because it is
Yes.
tough. You have many products these days which we are
Right.
using. So the simplest way is after, suppose you are going for a morning walk. In Delhi, we have a sun at 6:30 itself. So you should be using sunscreen while going to your morning walks or jogs. Then after bathing, it is an important part. So you can apply your moisturizer if you have a dry face, and then over that your sunscreen. And if you're going out in sun, then repeat it every 3 hours. Otherwise, these two are the major indication when you should start using it. First is in the morning walk, then after bathing.
Right. And many times people also use makeup. So, what should be the chronological order? I mean, you have already explained that moisturizer first, then sunscreen. But where does
And
this
then over
makeup?
that your makeup. So
Okay,
sunscreen and
okay.
then over that your makeup.
And
So, sorry.
and
So
many
what
makeup products are also coming with SPF, doctor. So, are they equally good, or we still need a standalone sunscreen?
See, as I told you that you require 2 milligram per centimeter square. So if you
Uh,
use that makeup content, that compound that much, तो आपका makeup का tube तो एक दिन में खत्म हो जाएगा. You can't do that.
right.
And if you're using it in a less amount, it is not working.
Right. So we know. Yeah.
So they are good, but they will not work that well.
Okay. मुक्ता ठाकरे हमारे साथ है. मुक्ता का क्वेश्चन है, आर देयर एनी एज स्पेसिफिक recommendations for sunscreen use, such as for older adults or individuals with certain medical conditions?
As such, see, we should be wiser with kid sunscreen, as I told you. But otherwise, we can use it sunscreen with everyone, for every age group. The only thing what we need should be wiser is like you have a sensitive face. You know, some patients have rosacea, some patients have acne. So probably I'll be using some different kind of a sunscreen for those patients. Otherwise, for 60 plus also, I can use the same sunscreen what I'm using, or anyone 20-year-old is using.
Okay. Now, as we were discussing initially, that 67% of Indian population is still not using sunscreen as their regular skincare routine. Now, they have n number of complaints or reasons not to use sunscreen. They'll say probably that I get that white cast, which I don't like, or I don't like the feel of it because it makes my skin very dull, or it makes me sweat a lot, or I have acne. I don't want to, layer up my acne with these sunscreens. How would you like to address this thing, doctor?
That is why we require a help of a dermatologist. I told you, we have a lot of sunscreens, and I myself cannot use many sunscreens. I have irritation in my eyes as soon as I use sunscreen. So
Mm.
there are particular brands which I can use, and I know they suit my skin. So over the period, it is not in the first go. Probably your dermatologist also will not be able to do it in the first go. He might give you 3, 4 options, and then you will be able to use one of the either one. The only thing is we get disheartened. जैसे हमने एक सनस्क्रीन खरीदा वो लगाया, we didn't feel it good, ये तो बेकार चीज है. But then over the period, if you don't use it, things will become bad. So the earlier you learn about it, you learn it with your dermatologist how to apply it and which sunscreen is best for my skin. So there will be a hit and trial initially for 2, 3 sunscreens probably sometimes, and then you'll find your better sunscreen, and don't then shift it again and again unnecessary.
मैंने भी ये सुना है, जब आपको अपनी तरह का सनस्क्रीन मिल जाता है एंड यू नो दैट दिस इज इट, इट वर्क्स लाइक मैजिक ऑन यू. और कई लोग जिन्होंने सनस्क्रीन पहले कभी यूज नहीं किया, और जब उन्हें उनकी तरह का अच्छा सनस्क्रीन मिल जाता है तो 6 महीने में ही उनको वो फर्क नजर आने लगता है कि सनस्क्रीन लगाने से पहले क्या था और अब क्या हो गया है. और यहीं से कहीं ना कहीं मुझे लगता है, वो जो शुरुआत में आपने कहा था कि यू ऑल्सो सी सनस्क्रीन एज एंटी एजिंग प्रोडक्ट, तो मेरे ख्याल से यही से वो एक बात भी निकल कर सामने आती है कि सनस्क्रीन आपके चेहरे पे इतना कमाल कर जाता है कि कुछ महीनों में ही आपको उसका फर्क दिखने लगता है. सो डॉक्टर, हाउ इट वर्क्स एज एन एंटी एजिंग प्रोडक्ट एज वेल?
सी एज वी डिस्कस दैट सनस्क्रीन जो है वो हमारे रेडिएशन से यूवीए यूवीबी से बचा रहा है. तो जितने भी ये रेडिएशन है यूवीए यूवीबी, यूवीए गोज डीपर. सो डीपर रेडिएशंस में वो आपके स्किन को डैमेज कर रहा है, आपके डीएनए को डैमेज कर रहा है, इवेंचुअली कॉजिंग इंक्रीज इन रिंकलिंग. तो आप अगर सनस्क्रीन रेगुलर लगाते हैं तो आपका रिंकलिंग पार्ट कम हो जाता है, फॉर विच यू आर यूजिंग रेटिनॉल टू रिड्यूस दैट. बट सनस्क्रीन इज अ पार्ट which will help you to reduce the wrinkle itself, because they'll not come up. You'll not have that much DNA damage.
राइट. हमारे साथ जिया है. जिया पूछ रही है, व्हिच टाइप ऑफ सनस्क्रीन इज सुटेबल फॉर ऑयली स्किन?
So you can use a matte finish sunscreen or a gel based sunscreen which are good for oily skin. So these are
राइट.
the sunscreen which do not have a lotion or a cream. So now you have a silicone based, gel based sunscreen which are completely matte finish. You'll feel that वो बिल्कुल बस merge हो गए skin में, and उसमें कोई oil factor नहीं होता, कुछ नहीं होता. Very beautiful
राइट.
sunscreen now you have.
हमारे सोसाइटी में डॉक्टर बहुत ज्यादा पिगमेंटरी इश्यूज भी हमको देखने को मिलते हैं. हाइपर पिगमेंटेशन, मेलास्मा, रोसाशिया, देयर आर सो मेनी थिंग्स, वुमेन में भी कई बार ये चीजें बहुत कॉमन होती हैं. क्या ऐसे में एज अ प्रिवेंटिव मेजर सनस्क्रीन यूज कुछ वंडर कर सकता है, बचा सकता है हमें इन पिगमेंटरी डिसऑर्डर्स से?
सी डिपेंड्स, अगर आपकी फैमिली हिस्ट्री है, सपोज माय मदर हैज गॉट मेलास्मा, सो फीमेल्स में मेलास्मा होने का चांसेस ज्यादा होता है, सो probably my mother has got melasma, so I have got a tendency to get melasma, that is for sure. So I should be using sunscreen more judiciously. I should be starting at early ages, because that is the only thing which will help us. So if we talk about pigmentary disorders, sun is the main culprit causing it. So the
हुँ,
more you avoid the sun or you use sunscreen, you are better off. So from family history. Otherwise, as soon as you see the signs of those spots of pigmentation, you should be judiciously using sunscreen. As you said in the earlier questions, कि आपने कहा था कि लोग sunscreen को वो यूज नहीं करते, कि फील गुड फैक्टर नहीं है। हमारे पास भी
हुँ,
पेशेंट्स आते हैं, मेलास्मा हो गया, दे बीन यूजिंग कोजिक एसिड, रेटिनॉल, सब कुछ कर रहे हैं, बट सनस्क्रीन नहीं लगा रहे, कि डॉक्टर साहब मजा नहीं आ रहा। बट दैट इज द
हुँ।
मोस्ट इंपॉर्टेंट थिंग टू हेल्प यू आउट।
राइट। और जैसा कि आपने कहा कि जब मेलाज़्मा हो गया है या कोई दूसरी पिगमेंटरी इश्यू का ट्रीटमेंट चल रहा है, तब भी एक मतलब एक प्रिवेंशन के तौर पे तो हम यूज़ कर ही रहे हैं सनस्क्रीन, और ट्रीटमेंट का भी सनस्क्रीन पार्ट बन जाता है और इसलिए ट्रीटमेंट में भी उसका यूज़ बहुत ज़रूरी हो जाता है डॉक्टर?
बिल्कुल, आप अगर कभी भी प्रिस्क्रिप्शन देखेंगे, कोई भी पिगमेंटरी डिसऑर्डर, सबसे पहले डॉक्टर हमेशा सनस्क्रीन लिखेगा। दूसरा,
हुँ,
जितने भी हम ट्रीटमेंट्स करते हैं, उसमें मोस्टली पीलिंग एजेंट्स होते हैं। सो योर स्किन लेयर वी हैव थिन्ड आउट अ लिटिल। सो
हुँ,
आपका सन एक्सपोज़र और बढ़ गया है। सो इफ यू आर नॉट यूजिंग दोज़ सनस्क्रीन विद योर ट्रीटमेंट, प्रोबेबली यू माइट एंड अप इन गेटिंग मोर पिगमेंटेशन।
हुँ, हुँ, ओके। एक्ने प्रोन स्किन पे भी मैं फिर से बात करना चाहूँगी। कई बार होता है, हमें लगता है स्पेशली जो एक्ने प्रोन पीपल है, दे विल अंडरस्टैंड मी कि एक्ने ट्रीट करना ईज़ी है, लेकिन एक्ने के बाद जो पिगमेंटेशन छूट जाता है या जो स्कारिंग होती है, वो ट्रीट करना ज़्यादा मुश्किल हो जाता है। ऐसे में एक्ने अगर है, तब भी क्या आप सजेस्ट करते हैं कि सनस्क्रीन यूज़ करें ताकि पिगमेंटेशन ना हो या दूसरे जो प्रॉब्लम्स हैं वो ना हो?
अगेन हमने जैसे पिछली बार भी बोला था अभी, कि जब भी एक्ने का ट्रीटमेंट होता है, तो आपने देखा होगा मेनली प्रोडक्ट्स क्या होते हैं, रेटिनॉल, एडाप्लेन, जितने भी पीलिंग एजेंट्स है, वो बहुत, ग्लाइकोलिक एसिड, ये सब यूज किया जाता है। सो
हुँ,
हमने ऑलरेडी आपकी स्किन को थोड़ा सा उतार दिया बिकॉज ऑफ कॉमेडॉन्स, तो आप सन एक्सपोजर से और पिगमेंट के लिए प्रोन हो गए हैं। सो ओवरऑल पेशेंट विल टेल मी आफ्टर 2 मंथ्स कि डॉक्टर साहब मेरा फेस थोड़ा डल लग रहा है, सो वी स्टार्ट सनस्क्रीन एज सुन एज पॉसिबल। अगर बहुत इरिटेटेड स्किन नहीं है, तो वी स्टार्टेड आफ्टर 15-20 days, एंड दैट इज अगेन इंपॉर्टेंट पॉइंट। देन अगेन यू गेट एक्ने पीआईएच, कि एक्ने जब सेटल हुआ, तो वो अपना पोस्ट इन्फ्लेमेटरी हाइपर पिगमेंटेशन अपना स्कार छोड़ गया। सो इफ यू यूज सनस्क्रीन, तो वो पीआईएच होने के चांसेस कम हो जाते हैं, एंड जो आपकी हीलिंग प्रोसेस है, इट बिकम्स फास्टर।
राइट। एक और सवाल है यहाँ पे हमारे एक व्यूअर का, रश्मिका चौक से है, पूछ रही हैं कि कैन सनस्क्रीन हेल्प प्रिवेंट स्किन कैंसर और इज इट प्राइमरीली फॉर सनबर्न प्रोटेक्शन?
No, see, as I told you, you have UVA, UVB filters. UVA is mainly, preventing the skin cancers also, and UVB is also, causing skin cancers. So initially, though, they were used in, outer countries to prevent the cancers only. And over the period, then we found out that it has got many effects in aging process, halting the aging process, pigmentation, and then we started using in other areas as well.
राइट। समर्स हैं डॉक्टर, और समर में तो फिर भी हमें लगता है कि ठीक है सनस्क्रीन यूज कर लेते हैं, रेपिटेशन ना भी हो, रीएप्लिकेशन ना भी हो, लेकिन एक बार तो मेरे ख्याल से मोर और लेस सब लोग यूज कर लेते होंगे। लेकिन जब क्लाउडी होता है, हेजी होता है, व्हेन इट रेन्स और व्हेन इट इज द विंटर, पीपल नॉर्मली डोंट यूज सनस्क्रीन। दे विल से है ही नहीं, धूप ही नहीं है तो सनस्क्रीन की क्या जरूरत है, या अपने आप ही कहीं ना कहीं एक मेंटालिटी रहती है और हमारा सनस्क्रीन यूसेज जो है वो कम हो जाता है। वो कितना खतरनाक हो सकता है?
कि अगर आप वापस थ्योरी को पढ़ते हैं, तो इट सेज कि 80% ऑफ द रेज आर कमिंग थ्रू द क्लाउड्स एज वेल। सो आपका
हुँ,
क्लाउडी होना, विंटर्स में लोग सनस्क्रीन नहीं लगाते, ठंड है,
हुँ,
बट देन विंटर्स में सन एक्सपोजर हमारा सबसे ज्यादा, बिकॉज वी आर एंजॉइंग द सन। सो पीपल
राइट।
इन दिल्ली, व्हाट वी हैव सीन, कि डॉक्टर साहब विंटर्स ही मैंने सनस्क्रीन नहीं लगाया। सबसे
हुँ,
इंपॉर्टेंट सन, समर्स में तो हम वैसे ही बचते हैं सन से। यू
हुँ,
माइट
हुँ।
नॉट ऑल्सो यूज इट बिकॉज यू आर एट होम, but winters में it is the most important part. Then again in a rainy season when it is cloudy, 80% of the rays are coming, and then you get tanned a lot. So that is why you should use sunscreen in these seasons as well. You might not feel that sun is there, but उसकी rays जो आ रही है, visible light आपको नहीं दिखती, but UVA, UVB पहुंच रहा है आप तक।
ओके, तो whether it's raining or it's cloudy or it's sunny or it's winter, you need to use sunscreen
Sunscreen if you are
regularly when
going out.
it's
Yes, yes, yes.
right, right. सनस्क्रीन पे हम लगातार बात कर रहे हैं और सनस्क्रीन पे हमारे जो व्यूअर्स हैं ये भी लगातार हमें अपने क्वेश्चंस भेज रहे हैं। सनस्क्रीन की जब भी बात होती है, समर है अगेन और वेकेशन पे हम सब जाना बहुत पसंद करते हैं। बीच वेकेशन पे जाते हैं जब डॉक्टर, तब तो फिर भी हमें लगता है कि अच्छा बीच पे जा रहे हैं तो सनस्क्रीन लेकर चलना चाहिए। लेकिन जब हम अपहिल जाते हैं, माउंटेन्स पे जाते हैं, ट्रेकिंग के लिए जाते हैं, तो हमें लगता है कि प्लेजेंट है वेदर, हम तो स्नोफॉल देखने जा रहे हैं, हमें सनस्क्रीन की क्या ज़रूरत है? But I have seen a lot of people who do trekking or who stays uphill have these pigmentary issues. तो क्या uphill या mountain पे अगर हम जा रहे हैं तो वहां पे भी sunscreen equally important है?
In fact, it is more important as you go uphill, you are more prone for rays, you are gone to an altitude, तो आपके पास और ज्यादा रेज आ रहा है। दूसरा, स्नो इज अ वेरी बिग कल्प्रिट। मेरे पास बहुत सारे पेशेंट हैं, लेह लद्दाख घूम कर आए एंड दे गॉट अ बर्न, तो दे गॉट अ फेस बर्न, स्कैल्प बर्न, एंड दैट इज बिकॉज स्नो रिफ्लेक्ट करता है रेज को और ज्यादा, एंड यू गेट अ बर्न ऑल्सो। सो दीज हाई ऑल्टीट्यूड और बीच लोकेशन रिक्वायर सन इवन मोर, and you should be repeating it every 2 hours, and that is why you look for those people who stays in mountain. You'll see more of pigmentary changes, more of wrinkling of the skin faster they get it, because sun exposure ज्यादा है and sun का जो intensity है वो भी वहाँ ज्यादा है थोड़ा सा।
राइट, तो अगर हम बीच वेकेशन पे जा रहे हैं या अपहिल जा रहे हैं, क्योंकि यहाँ आपने कहा कि सन से जो हमें डैमेज हो सकता है, सन के रेडिएशन से वो बहुत ज्यादा हो सकता है, खास तौर पे क्योंकि स्नो से रिफ्लेक्ट होके सन रेज आ रहे हैं या वाटर से, बीच पे वाटर से रिफ्लेक्ट होके आ रहे हैं। ऐसे में क्या एसपीएफ होना चाहिए या फिर हमको पूरी बॉडी पे, बिकॉज बीचेस पे तो वी आर मिनिमल क्लोथिंग, तो क्या-क्या हम और ध्यान में रख सकते हैं पूरी बॉडी पे, किस तरह से हम सनस्क्रीन इक्वली स्प्रे करें, लगाएँ?
So now the concept comes as lotion and spray form are better for the body. दूसरा,
हुँ,
जब when you're going for these activities, use minimum 50 SPF, because as I told you, when you're out in sun, 2% also matters and it can cause a burn. And another thing is 50 SPF will degrade a little slower than 30 SPF. So use a higher SPF when you're traveling. When you're going to these locations, use lotion based or spray based, because you can apply them more easily. And there are water resistant sunscreen who have been tested in water for an hour or two. So they have that property of staying in the water as well. Their chemical property will stay and prevent you from sun rays.
ओके, तो इन चीज़ों का हम ध्यान रख सकते हैं। जो फिज़िकल बैरियर्स हैं, वो कितने हेल्पफुल होते हैं यूजिंग अ कैप, हैट और अम्ब्रेला एटसेट्रा?
See, the problem is when you are in the beach, you might not be using anything,
हुँ,
you know, because
राइट,
everything will get wet. But then physical barriers are the most important. If you ask me whether sunscreen is better or physical barrier, then physical barrier is the best. You wear a cloth, full sleeves cloth, it will work magically. You cover your face, it will work magically. So I tell my patients, add on physical barriers along with sunscreen. Suppose you're going out to travel, use umbrella, use hats, because it does prevent from sun. I play a lot of lawn tennis, so I usually wear a cap and put sunscreen, so it helps in both the ways.
राइट। तो बीच पे ना भी जा रहे हो, इन जनरल भी हम ये फिज़िकल सन ब्लॉकर्स यूज़ कर सकते हैं,
बिल्कुल,
राइट।
और ये इम्पोर्टेंट है।
बिल्कुल। बच्चों के केस में भी ऐसा होता है, अब तो कपड़े भी बच्चों के लिए कई आ गए हैं जो सन रे से प्रोटेक्ट करते हैं बच्चों को, उनका इस्तेमाल किया जा सकता है डॉक्टर?
किया जा सकता है, बट आई थिंक एवरी क्लॉथ इज प्रोटेक्टिंग यू। अगर आपका क्लॉथ अच्छी तरह वोवन है तो इट इज प्रोटेक्टिंग यू, और ब्लैक नहीं है, ब्लैक टेक्स सन मोर। और अगर आपका व्हाइट क्लोथिंग है और सब कुछ है तो इट प्रोटेक्ट्स यू प्रीटी वेल। नाउ देयर इज अ कांसेप्ट ऑफ ओरल सनस्क्रीन आल्सो। पीपल हैव कम अप विद ओरल सनस्क्रीन व्हिच ट्राई टू हेल्प अस अलोंग विद दे आर नॉट द रिप्लेसमेंट फॉर फिजिकल सनस्क्रीन, बट सपोज यू आर ट्रैवलिंग अ लॉट, देन यू कैन ऐड ऑन अ ओरल सनस्क्रीन अलोंग विद टॉपिकल सनस्क्रीन।
ओके, तो ओरल सनस्क्रीन ऑप्शंस है, फिजिकल ब्लॉकर्स तो है ही और सनस्क्रीन तो है ही, जिस पर हम लगातार बात कर रहे हैं, जिसे हमें रोज इस्तेमाल करना है विदाउट फेल। इसके साथ ही साथ हम ये भी जानना चाहते हैं कि कई लोग होते हैं, उनका वर्क कल्चर इस तरह का होता है कि उनका या तो फील्ड में है तो सन एक्सपोजर ज्यादा है, या फिर स्विमर है तो पानी में बार बार उनको जाना है, बहुत ज्यादा वक्त उनका पानी में जाता है, क्लोरीन भी है उस पानी में, या फिर एथलीट हैं जो बहुत ज़्यादा स्वेट कर रहे हैं, अंडर अंडर द सन हैं, तो ये किस तरह से अपना सनस्क्रीन चूज़ करें?
See, athlete, आपने देखा होगा cricketers usually use a white cast sunscreen. So they are
यस।
physical blockers more, zinc oxide, titanium oxide, because they are the safest and they have a thick layer and they go to 70 SPF also. So athlete,
ओके,
depending on the sports, you can change your sunscreen. As I told you, it is about the skin, what work you do, and sunscreen changes. So if he's a cricketer, I'll jot down a different sunscreen. But अगर पानी में जाते हैं, तो I will use a water resistant sunscreen. So it depends on the sport which they are playing, and then accordingly we can judge the sunscreen.
और उसके लिए भी again we can seek advice from a
From a
qualified
nearby dermatologist, yes, they can help you out.
Right. But what happens many a times we'll waste a lot of time over home remedies or going for over-the-counter product or what the influencer is saying or, asking a friend or family, etc. कई बार हम बहुत ज़्यादा पैसा इन सब में खर्च कर देते हैं, बहुत ज़्यादा एक्सपेरिमेंट कर देते हैं, बहुत सारे प्रोडक्ट्स ले लेते हैं एंड देन वी रियलाइज कि इसमें से कुछ भी काम नहीं आ रहा है. तो प्लीज सेव योर मनी, सेव योर एनर्जी, सेव योर टाइम, save your skin, save your health, and go to the right person, which is a qualified dermatologist, a nearby dermatologist. Sunscreen तो है ही, अपने आप को, अपनी स्किन को प्रोटेक्ट करने के लिए और हम क्या कर सकते हैं, जो बेसिक है जो हम कर सकते हैं स्पेशली सन डैमेज से बचाने के लिए डॉक्टर?
The diet also plays a role. If you have a healthy diet, that also helps us. Beta carotene, जैसे गाजर है, lycopene है, ये सारे also antioxidant products हैं which tries to prevent damages from sun. So oral sunscreen concept has come in the same way. What it does is it tries to prevent the damage. It is not a sunscreen. What damage sun is doing, they are trying to prevent it with some extract, plant extracts, or beta carotenes. These are the oral sunscreen which help us. So you can take them with food, lycopene, vitamin C, then again carrot. These are the good compounds which try to prevent you from sun if you're taking in a healthy meal.
Right. So a good and balanced diet is important. Your lifestyle definitely plays an important role. And plus sunscreen is one thing that you need to apply regularly and religiously. Sunscreen पर हम लगातार बात कर रहे हैं डॉक्टर, इतनी बात हमने sunscreen पे कर ली. और कोई ऐसा कॉमन मिस्टेक जो जब लोग आपके पास आते हैं और आपको सुन के लगता है कि अगर इन्होंने पहले सनस्क्रीन यूज किया होता तो ज्यादा बेटर रहता. वी हैव अ लॉट ऑफ फेथ ओवर होम रेमेडीज और इस हद तक कि जैसा आपने कहा कि इन चीजों को खाना बहुत जरूरी है जो हमें अलग अलग एंटीऑक्सीडेंट्स, बीटा कैरोटीन, बहुत सारी चीजें, न्यूट्रिशन, विटामिन जो हमें मिलता है. कई लोगों को लगता है कि ये चेहरे पे लगाना बहुत अच्छा होता है, फिर लगा और अच्छे से नहीं धुला और हम बाहर चले गए उसके साथ तो एक अलग ही सिंथेसिस की प्रोसेस उसके साथ होने लगती है. तो ऐसे बहुत सारी छोटी छोटी मिस्टेक्स जो हमारी स्किन के लिए बहुत हानिकारक हो सकती है.
सी यूजली आजकल कॉन्सेप्ट है कि लोग ना बहुत हीलिंग एजेंट जैसे जितना भी extracts हैं, whether it's a lemon extract, potato car extract. So they are all acids. So they are peeling your skin. And if you're not using a proper sunscreen along with them, suppose you're doing a home remedy also. So if you're not using properly sunscreen, and then they can cause damage to your skin. Then in home remedies, I will not say that every home remedy is bad. Aloe vera is a very good sun protector also. It is a moisturizer also. So you can use that, but that will not suffice you in the sun. It is a good compound, but then it is not the compound which can take care of sun in a proper way. So if you're using home remedies, then also you should use sunscreen because that is specifically meant, and you have a compound which is measured कि ये 30 SPF है तो 30 बचाएगा, 40 बचाएगा. आपको पता ही नहीं आपका एलोवेरा कितना बचाएगा या नहीं बचाएगा.
राइट राइट. तो एक जैकेट की तरह, जैसा जैकेट हम वेयर करते हैं सब कपड़ों के क्लोथिंग लेयर्स के ऊपर, वैसे ही हमारी स्किन पे हमेशा एक जैकेट सनस्क्रीन का जरूर होना चाहिए. तो उससे पहले जो भी हमने किया हो एटलीस्ट उन सब से हमारा सनस्क्रीन हमें बचाता है. प्रिवेंशन के तौर पे भी हमें सनस्क्रीन यूज करना चाहिए, ट्रीटमेंट के तौर पे भी डॉक्टर सनस्क्रीन रिकमेंड करते ही हैं और अच्छा सनस्क्रीन चुनने के लिए हम डॉक्टर की मदद तो ले ही सकते हैं. So Dr. Kapil, before we sum up the whole session, any take-home message for our viewers?
See, important is that we start using sunscreen at the right age, and if you're going out in sun, if you're an athlete or we are playing a lot or we are going out in sun, we should be using sunscreen. It is up to you how to, how to find your right sunscreen with the help of a dermatologist, or if you can go to some cosmetic person who can help you out. But start using sunscreen, and most important is you will have difficulties while using sunscreen, probably white cast, आंख में irritation आना, कभी acne होना. Then you need to change the brand and you need to find your brand and start using it properly. That is the most important thing.
Thank you so very much, Dr. Kapil, for your valuable time. So it has been a very informative session for our viewers, and it was wonderful hearing you. Thank you so very much once again.
Thank you very much. Thank you.
And
Bye-bye.
viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page Have a good day ahead. Take care of your skin. Stay spotless, stay beautiful, and keep glowing. Thank you. Goodbye.
Take care. Bye bye. Bye bye.